Technologies, CAMTech Uganda has organized the 8th annual MedTech Hackathon that will bring together global innovators to solve critical health challenges in the era of emerging pandemics through innovation. This will be from 30th September to 2nd October this year. Do you have a challenge that you could solve in the health sector? Apply today. The Consortium for the Affordable Medical Technologies, CAMTech Uganda, has organized the 8th annual MedTech Hackathon of critical health challenges in the era of emerging pandemics through innovation. This will be from 30th September to 2nd October this year. Do you have a challenge that you could solve in the health sector? Apply today. The Consortium for the Affordable Medical Technologies, CAMTech Uganda, has organized the 8th annual MedTech Hackathon that will bring together global innovators to solve critical health challenges in the era of emerging pandemics through innovation. This will be from 30th September to 2nd October this year. Do you have a challenge that you could solve in the health sector? Apply today. The Consortium for the Affordable Medical Technologies, CAMTech Uganda, has organized the 8th annual MedTech Hackathon that will bring together global innovators to solve critical health challenges in the era of emerging pandemics through innovation. This will be from 30th September to 2nd October this year. Do you have a challenge that you could solve in the health sector? Apply today. The Consortium for the Affordable Medical Technologies, CAMTech Uganda, has organized the 8th annual MedTech Hackathon that will bring together global innovators to solve critical health challenges in the era of emerging pandemics through innovation. This will be from 30th September to 2nd October this year. Do you have a challenge that you could solve in the health sector? Apply today.
Okay, good morning to you all. My name is Mbarara. I work with the Consortium for Affordable Medical Technologies as a research and grants manager. I'm here with my colleagues, and I would like to ask them to introduce themselves before we can start.
Good morning, everyone. My name is Martin Mukama. I also work with the Consortium for Affordable Medical Technologies, CAMTech Uganda, and I work as the Innovation Lab Manager.
Yes, good morning, everyone. So my name is Mackenzie Tuirwe, and I work with CAMTech Uganda as the Assistant Innovations Lab Manager.
Thank you so much. First of all, I would like to welcome everyone who has already logged in. Session, as some of us are already aware, we shall be conducting our hackathon this year, the 8th Medical Technology Hackathon, Sunday, this month and next month, of course. So we are here to brief you about the hackathon. Some of us who have not heard about the hackathon or who know nothing about the hackathon, you feel free, you'll be free to ask any questions. We'll take you through what a medical technology hackathon is, how we are conducting it. This is the 8th. We had actually spent 2 years without conducting any hackathons, but now it's back and we are excited because out of the hackathons we have seen many solutions put out there to benefit their intended end users. So as CAMTech, we are excited, and the MAST community, to have our medical technology hackathon again. We have been advertising the hackathon and flyers. Some of you have already applied. Some of us who have not applied yet, the link is out there. We will share it, I think, on the screen later. But at least we have tried to make sure that the information, the message goes out. So our application deadline will be 10 September. So by 10 September, everyone who is interested in applying and attending this year's hackathon should have applied. Okay, so I have just a slide that I will take her through. Let me quickly do a screen sharing. But if you have any questions, please feel free to ask after my presentation. It's not going to take a lot of Okay, so this is how a hackathon, like I said, this is our 8th annual medical technology hackathon. It's a 48-hour event which starts with it starts on Friday with a clinical summit, pitching on Saturday, and then it goes all through to Sunday. I'll briefly take us through what happens or what will happen on Friday. So on Friday 30th September, we will have what we call a clinical summit. It's an event where we invite experts, because with the hackathon you come with a challenge. So we invite experts about the challenges they interface. Most people we invite are from health facilities, the medical doctors, because it's a medical hackathon, a medical technology hackathon. So we are developing solutions to improve our healthcare, or to improve the way we serve people, patients, to make sure that the healthcare is improved in Uganda and in Africa. So on Friday we have panels. We usually have about 3 panels of experts who speak to participants about the challenges. So they don't talk about solutions, all they talk about are challenges they interface. And from that talk, participants are able to pick out which challenges they would be interested in working on the next day, that is Saturday and Sunday, because that's when the real hackathon starts. Still that Friday on 30th September evening, we will have a cocktail. And of course, you know what a cocktail entails. It's eating, getting to know each other, dancing, and, mixing up, because the next day you're looking at having a team, forming a team that can work together with you to make sure that you have a product or a prototype. So it's more about getting together and teaming and get to know each other. Those are the hackathon participants. So that will happen on Friday evening. And then, as of course, there's dancing, it's just fun. On Saturday, 1st October, the pitching starts. Of course, we will start with speeches, like the opening speeches, a keynote address, and all that. But after that, we have individuals or participants start to pitch. Pitching means you have a challenge you have identified, and that's the challenge that you're interested in. So you stand up and talk about your challenge in 1 minute. No solutions, it's just a challenge. So you pitch your challenge or you present your challenge in 1 minute, then you go and register on the challenge registration or pitch registration table. We will have computers and individuals or volunteers who will be helping people to register their challenges online. No solutions at that time, it's just challenges. And the pitching goes on, and then thereafter, registering your challenges, you now start convincing people to join you, because we believe innovators don't work as individuals. We encourage people to work as a team. So after pitching, people start forming teams. You walk to people and encourage them to join you to form a team that can work on your challenge. Of course, some challenges are dropped. Sometimes when people talk to you and you feel, okay, maybe this is not, let me join so and so. Or sometimes you find the challenges are similar, so you decide to join another team to make sure that, you come up with a solution. And we always have prototype materials. So if you need anything to build your solution, we have the prototype materials available. Sorry about that. So still on Saturday, what I want to let you know is that you don't work alone as a team. We have experts who are mentors moving around the room, guiding people, and then also innovators asking for guidance. And there is no age limit for you to be an innovator. It doesn't have to be only students, even faculty from different institutions, from different countries. They can be part of the hackathon. So we identify mentors and experts in different fields, medical, business, engineering, all fields, to be around or to be part of the hackathon, specifically to guide the teams. So they work with the teams and guide them to come up to define the problem very well and the solution that they are proposing. And then when it gets to building the solution, they also help to guide them and also putting together their presentation slides and all that. So on Sunday, presentations start. What I did not mention at the beginning is we have prizes to give out. So there's a whole lot of competition. So we have prizes that are given out to the best teams. I'll be talking about that towards the end. And the best teams, of course, are awarded. So there are several sets of presentations before the panelists. We have judges or panelists who kick out. Teams present for the first time. they come, of course, they come up with those that are moving on to the next level. They come back again and present, and then there are those until they come up with the best or the top teams to be awarded. On Sunday, of course, there is an announcement of the winning teams, and you know, all that pressure, and people are jubilating and celebrating about the wins. Money, some end up sharing their monies, of course, that is awarded to them as a team. So this is the list of prizes that will be given out. We have the first winner, or the top team, topmost team will be awarded. Then we have the first runner-up, second runner-up, third runner-up. What we have not added here is there are two wins also for the judges mentioned for the two teams that are mentioned mostly. They may not have the best solution or idea, but if they are talked about more, like by the judges, so two teams are also selected and awarded. But it depends on how, of course, that is from the judges. They'll say, okay, these are the mostly mentioned teams from all those that have pitched. This year, we have added another win for the best pitcher. The person who presents very well will be awarded. We have partnered with AIT, Empower Youth in Technology. They will be awarding that prize of the best pitcher, and they are giving out a brand new laptop. The person who will present very well, and that person will be identified by the judges still. Thank you so much. I will invite my colleagues in case they have anything to add to that, but that's the end of my presentation, I think.
I don't have anything to add really, but we are going to invite people for Q&A. There is someone that has been raising their hand. All right, if anyone has questions, this is the time, and the team is here to answer all questions that you might have. Barbara, you can unmute and ask a question. Yes.
Yes, we can hear you. Yes, we can hear you. We can hear you, Barbara. Yes, please go ahead, Barbara. We can hear you. We can hear you. Barbara? Okay, thank you, Barbara, for that question. So when people come to the hackathon, they come with just a challenge. We encourage people to come with a challenge. So when you come with a challenge, you don't have a solution, though that may not be controlled. But when you present your challenge and register it, you call upon people to join you to solve that challenge as a team. Of course, some teams will be like 2 members or 3 or 4, depending on how you have convinced participants and how you have convinced people to join you. So sometimes you find that some people agree. We don't force you to join teams. Some people will agree and say, okay, we have the same idea. Why don't you? We have the same challenge. Why don't we join and look for a solution together? It could be a challenge to do with maybe access to mental health care services, and someone else has pitched the same idea. So instead of saying, okay, we are going to work independently, maybe you could work together, or you say we are working independently, but the solutions might come out to be different. Same challenge, but different solutions. So it all depends on you. That's why we start with a cocktail, and then in the morning of the Saturday, the hackathon starts, because you need to talk to people, you need to know each other, and you need to convince people to join you. I hope I've answered your question. Have I answered your question, Barbara?
All right. There's Andrew's hand is up. You can unmute and ask a question, Andrew.
Yes. Good morning, Martin and Nuriat.
Good morning.
Yes. Now, my question is simple. Issues regarding can't we have an online participation for the likes of us who stay away? Though I've seen there is a disadvantage of an online session, according to what I'm seeing now. So I don't know if we can have an online participation. Yeah. Thank you.
Okay, thank you so much. That we have not planned because an online hackathon is tricky to organize, because you need to build a solution as a team. So I'm wondering how you're going to form a team and then you build a solution and present it. For sure, I can't promise. Right now, we are looking at a physical hackathon, because you need to be there, you need to build, you need to get mentorship. So that's why we are looking at people being here physically. But if it comes in, then we'll communicate. But the way a hackathon is conducted, it's tricky to have it online. Yes. Someone asked also a question about the venue. So it's going to be here at Mbarara University of Science and Technology, at the Faculty of Interdisciplinary Studies. There is one big room where we have always conducted it. But the clinical summit and the cocktail are going to be outside the university, but close to the university. We shall communicate the program to participants who will be successful, because people are still applying. We will select, those who will be part of the hackathon. So the application link is still open. You can apply, but it will be here at Mbarara University of Science and Technology. More questions?
All right. I see Winnie. Winnie, you have a question. You can unmute and you ask. Winnie. Let's listen from Winnie, and then after we shall listen from Lutaya.
All right, thank you so much. Very good morning. My name is Winnie Nabukera. I'm a nurse by profession. I had just joined the meeting, just actually hearing news. I don't know what is it all about. Maybe can we have just a 3 minutes recap of what the whole idea is about and something like that. Thank you.
All right. For people who joined late, this is an information session about the hackathon, and the hackathon is an annual event organized by CAMTech Uganda at Mbarara University of Science and Technology. It brings in people from all disciplines, and the purpose is to discuss health challenges and build appropriate technologies for those challenges. And of course, at the end of the hackathon, we award the best 4 to 5 teams. There are prize awards that we give to those teams, but we also later support them through our ecosystem at CAMTech Uganda. Is that okay?
Hello, yeah, that was amazing. Because when you talk about technology, right now, as I mentioned, I'm a nurse. I went through some kind of mentorship that after the mentorship, I decided to do my own private coaching program, and my niche was the nurses and midwives. I hope them to be able to find their purpose in life, their passion, and also knowing on how they can turn all that into profit. And it is online. All my resources are online, and everyone can be able to access them wherever they are. So I don't know if I'm best suited into that. Maybe you can advise.
All right, Winnie, for the hackathon, we actually are not interested in solutions that have been built before. We are interested in solving or addressing new challenges that people have experienced in different facilities. And so the people who come to the hackathon actually come to pitch health challenges, and during the 48 hours of hacking to build a solution, people start addressing those challenges that have been pitched. But we don't allow actually people that have previously built solutions to come and pitch those solutions. We are interested in challenges so that we address new challenges. And so, Winnie, if you have experienced any new challenges in the health sector, we'll be happy to have you, and we'll be happy to forming a team with the rest of the participants so that you can hack around the challenge that you have actually experienced.
Okay, thank you. Any other questions? Okay, Maurice, you can unmute yourself. Maurice, please unmute yourself and ask. Or Aisha.
All right.
Yes.
Thank you very much, Nuriat and Martin and the team. The hackathons are very, very good sessions for generating solutions to the healthcare challenges. My question is, could you throw more light on the particular theme for this year's hackathon? A little more light. Thank you.
Aisha, you can also ask. Let's take all the questions once. Let's take on more questions.
Thank you very much for the good presentation. I am Kites Aisha, a student in third year at Mbarara University of Science and Technology. I'm doing business administration. and it is my very first time to join the hackathon. So I would like to know how long will it take? Like, what is the duration for the pitching? And another thing, can we have pre-training sessions for the pitching session? Because I mean, I have not done it before, and I really want to take it up. Thank you very much.
Okay, I'll start with Maurice. The question about the theme. So the theme for this year's hackathon is building a resilient healthcare system in the era of emerging pandemics through innovation. So we are looking at how we can build a resilient healthcare system in the era of pandemics. You know, we've been hit by COVID, and you know, the healthcare system has been affected in one or the others in so many ways. So how can we bring out those challenges and build solutions towards solving such challenges? It's not only about COVID, but also other pandemics that we have seen hitting our countries in Africa. So that's it about the theme for this year. So the challenges we are presenting are related to that theme this year. Then the question what Aisha asked about pitching. Of course, we will not have, we will just give an example of a good pitch and a bad pitch. Because when you're pitching, we give you only 1 minute, but before teams start or individuals start pitching, we will have someone give an example, or 2 or 3 people give an example of a bad pitch and then a good pitch. What do you need to say? What do you need not to say in this pitch, in 1 minute pitch? Then all through, when you start working on your solutions or the idea, we have mentors. So we'll have mentors who are taking you around, and then teams will be guided on how many slides you need to put together and how you can pitch. Of course, you call for help from the mentors, from the experts who are around. So it's up to you as a team to ensure that you get all the guidance that you need from the experts in order for you to have very good presentations and also to have your idea well crafted for the competition. Have something to add?
That's okay. Lutaya, you can ask, and then after you, we shall take one from Moses Ochola. And we have opened up the chat again, so in case anyone has...
hello everyone, thank you for this beautiful session. Hello?
Yes, we can hear you.
Hello, can you... thank you. Thank you for this beautiful session. So mine is about the recording, because my network has not been so good. So I would like to know how I will get, I'll be able to get the recorded session, and also about transport. Since the session is starting on, the event is starting on Saturday and ending on Sunday. On Sunday, is it 7 p.m. So I'd like to know before Saturday. Sorry, before Saturday, and then Saturday.
All right, Rutaya Edward, I think if I got you clearly, you're asking about the recording because your network was very poor, and then you're also asking about the facilitation that we shall provide for the event. I think that's why you're asking about transport. So we are going to share this recording on email so that everyone has access, even the people who have not been in position to attend this information session. And then for facilitation, CAMTech will only provide meals for the event, but transport to the venue and your accommodation, that will all come from you. We will not be providing it. Looks like Moses dropped off. He's in. Moses, Ochola, you can ask.
Yes, please.
Yes, please go on. I think your hand was up.
Yeah, thank you very much. Actually, mine is not a question, but just something of a testimony from the last hackathon that I attended. I just want to encourage everyone that the hackathon will probably transform your mind and make you a better innovator. I got into the hackathon without any experience in anything like that, but the people you meet, the teams that you meet, and the solutions that you will see people fronting probably open up your minds into how to think about solutions that affect our environment, the clinical solutions. So I just encourage everybody to tell a friend, to register and come for the hackathon. It will just transform how you look at solutions and how you frame solutions. It's really an experience you don't want to miss. I've never stayed the same after the first hackathon that I attended. And I look forward to attending this one in full. Thank you.
Thank you, Dr. Moses. It's good. Thank you so much for that testimony. And I wanted to request you, if it's okay, you can mention something about one of your innovations that came through from the hackathon as an idea and where you are with it. Are you still there? Okay, I think he has gone. But I wanted to say that there are so many.
I am on. Yes, that I was not able to. Hello.
Yes, please go ahead.
So my name is Dr. Moses Ochola. I work at the Children's Ward of Mbarara Regional Referral Hospital, and I'm doing my master's in pediatric child health. At the time I came for the hackathon, I was a medical officer. I just started school, but then I was working still around. I worked in Mbarara Hospital, and we had a challenge of jaundice, children getting yellow when they were born. And so I came and I pitched the idea. I didn't know any of the team members, and then for some reason, a lot of people joined our team. Actually, initially there were 16 people, and of course, after some time, the team reduced. And we pitched at the hackathon. We were able to actually come up with a bit of a prototype of what we wanted, made out of cardboard. We didn't win at the hackathon then, but then we were very encouraged to move forward and continue working with CAMTech. And we went ahead and went through their, it's called the CAMTech Accelerator Program. The whole exercise, and they taught us a lot of things, and we were able to win an award then of $7,000. Still working with CAMTech and lessons from the hackathon. We went ahead and applied to the Ministry of ICT. We won another grant. Then we won a third grant, and right now we are probably at the stage of, we're almost having a ready prototype, and through CAMTech still we've been able to take part in very many other ventures, and we are still pitching different solutions. But all that is because of the exposure that we got at the hackathon. It can be done, no matter how complex your problem is. Come to the hackathon, you'll find a simple way to solve it. The mileage and the run we have gotten from the hackathon, I just can't explain. And we learned a lot. So I just encourage everyone that if Photocarbon did it, I don't have an engineering background, and I had never met any of the team members. I didn't know them, apart from knowing them casually. I didn't know their talents. But because of that, we were able to meet and we formed a very strong team. So I can share a lot, but briefly, that is what I have to share with the team that is listening again.
Thank you so much, Dr. Moses, for that testimony. And what we did not talk about is the post-hackathon support that we give to people or teams that have participated in the hackathon. So it does not, whether you win or not, we call upon, like we send emails to people, teams that have participated in the hackathon for possible post-hackathon support, which starts with putting together a concept, because during the hackathon you may not be able to fully describe the challenge and get all the statistics and make sure that what you're describing or defining as a problem It's well defined and based on literature. Then we train them, people who register, we train them in what we call a scientific writing workshop, and the output is a fully completed concept, which of course goes through vetting. They present their concepts after that before a panel of experts or reviewers who assesses them, and then they decide whether the team is ready to move on to the next level of officially getting registered into the co-creation lab for further support. But apart from that, we also have what we call CAMTech Accelerator Program Awards, or CAP Awards, which we give out. So after the hackathon, we announce the CAP Awards of $5,500, which we award to 3 teams, winning teams every year. But most of the teams that have taken these awards or that have been awarded are those that come from the hackathon, because they started with a challenge, they formed a team, they came and got trained as a team, they presented before a panel of experts who gave them guidance and feedback on how to improve on their concept, and then they compete for the CAP Awards. And after winning the awards, of course, we go ahead to support them to implement their project planned activities. But apart from that, even those who don't win, we support them. There are so many calls out there. As long as you have a well-defined challenge and the solution that you're proposing convinces the reader that it can solve the problem, and you have a good team that is committed. So there are so many calls. Ministry of ICT has been sending out calls for innovations or people who have good ideas, ministry, and also external funding from other sources. There's a lot of funding out there which can enable you to even employ yourself and employ other people. But it all starts usually with the hackathon. From the hackathon, you're able to form a team, and then you continue working together as a team. Thank you so much. Any other questions? Any other person who wants to ask? Okay, we have about 8 minutes to close this. If you don't have any questions, the application link, Martin, you can talk about the link and how people can get to apply.
Thank you so much, Nuliat. I've been posting the application link actually in our chat, but we'll be sharing still the application link via our emails, and it has been shortened really. So if you have internet, it doesn't take more than 15 minutes. You can send in your application, and by the 15th of September, you'll receive a confirmation email whether you've been confirmed to attend the hackathon or not. But we hope that we'll accept everyone that applies for this hackathon. So please keep those applications coming in.
What was it about? Okay. Oh, by 15th of September, we will have notified the successful applicants. But just keep the applications coming in. Share this link with other people in your networks, other universities. We want to see more people applying. What I want to tell you is that there are so many challenges around us in the health sector. And as Africans, as Ugandans, as individuals, we can contribute something towards solving the challenges. We don't need to wait for other people to bring us solutions. We can build our own solutions that are affordable and scalable, and we can see them working and doing what they are supposed to do, or benefiting the intended end users. This can start from the hackathon as you go on building your solution and getting guidance until you see your solution built, tested, deployed, and scaled up. So we'll be happy to see you all there in this year's hackathon. Thank you so much. Any conclusion?
So if we don't have any further questions, I think we are going to end this information session. We invite everyone to be part of this hackathon so that we can all contribute to improving health outcomes in our country and beyond our country. And of course, what I would like to tell you is that the health challenges that are faced in Uganda are also faced elsewhere in the African continent. So the moment you develop a solution that can actually work in our country, it will be in position to be scaled to other countries as well, so that way you can make a living from your intellectual power. So we want to call everyone to apply for the hackathon by the 15th of September. You'll be notified if you're attending or not, and we'll be happy to have you come and we hack together, come and we solve health challenges, come and we build solutions that will impact our health sector. We thank you and we hope to see you on the 30th. Bye.
Okay. Bye, everyone. Thank you so much for attending. We are excited about this hackathon and we hope to see you all. Thank you and bye.
Recording stopped.
The 8th Annual MedTech Hackathon that will bring together global innovators to solve critical health challenges in the era of emerging pandemics through innovation. This will be from 30th September to 2nd October this year. Do you have a challenge that you could solve in the health sector? Apply today.